Welcome to 3-Minute Gestalt and Unit 34 on addictions. So this is obviously a very, very big topic. I want to just mention a few things about the Gestalt orientation to working with addictions. Certainly there's ways to use Gestalt to support current models which are very popular, such as 12-step model, which is very effective for a lot of people and is a peer-based model and also has some spiritual components. So Gestalt can help people who are going through those 12-step processes to integrate what they're doing and provide therapeutic support for that. Above and beyond that, though, Gestalt itself, there's been some development of models of, for instance, using the stages of the awareness cycle to understand how to work with different elements of moving through addictions. Initially, often what happens with addictions is people's distressed feelings and their difficulties get replaced by some drug or some addictive substance or addictive process like gambling or whatever it is, to avoid dealing with uncomfortable sensations. And then once those sensations or feelings are identified, usually they flood the person and they're too much. So then obviously there's a lot of support needed at that second stage of the awareness cycle in terms of helping people stay with their awareness and not collapse and not explode. And then in terms of energy, there's a lot of energy that's tied up with addictions, that's focused on the addictions. So we look at how do we find other ways to mobilize people's energy in terms of growth rather than funneled into the addictive practice or behavior. And so each of these stages of the awareness cycle can be applied to working with addictions. The awareness cycle is quite a useful model in a whole variety of ways, and this is one of the examples. Certainly when we're working with addictions, often there's a trauma, and certainly that needs to be worked with, and there's often a great deal of fragility, and so especially support is important. And as with what we do in Gestalt, we're always looking for the right balance between challenge and support at each stage. So we do both. We take people into scenarios through the Gestalt experiment where there's some level of risk, and at the same time we provide a great deal of support so that people don't just become traumatized or frozen there. In terms of the dialogical relationship, it's an important underpinning to working with addictions because in many ways research has shown that addictions reflect a lack of relationship and a lack of support in the field in some form. So the development of the therapeutic relationship in Gestalt is key to helping a person through addictions, not just through helping them unhook from whatever they're doing, but providing a solid base. And it's very important in that base to apply the Gestalt principles where we're not fitting them into boxes or labels, or we're not trying to tell them what to do, how to live their life. We're not applying moral codes or shoulds. We're just working with the person as they are to increase their awareness, to help them be more of themselves and to provide a sense of contact with them. And often what happens in addictions is that things go wrong in the process of contact. So as a Gestalt therapist, by including ourselves and making ourselves transparent, not just trying to sort of fix up the person or help them up, but in fact to meet them, because that's very much how I think these peer programs are often successful, because they're people helping each other. So in the sense that Gestalt is often a horizontal type of relationship, which involves the therapist being there as a person, not just as a technician or a facilitator, that can also provide a very strong ground for supporting someone through the process of dealing with addictions.